Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. And on behalf of the Joint Task Force, I want to welcome you to the update for February 4th, 2021. We have some special guests with us today, so we're very happy to have those guests with us. So first, I'm going to give a few updates on data, probably not as extensive as we typically do. I also want to give some updates on vaccine distribution and what we can anticipate in the weeks to come. Dr. Randolph's going to then join and give some updates from his perspective and particularly talk about the importance of everyone having equal access to vaccine. And then we have guests from the Mexican consulate that have come here all the way from Little Rock. So our speaker today will be Rodolfo, and he'll further introduce himself. I honestly don't want to incorrectly pronounce his name. So he's going to introduce himself and really share from his perspective what's happening in promoting the access to vaccines across Western Tennessee, Arkansas, and Eastern Oklahoma, but particularly saying here why it's important for our Latino community to know they have access to the vaccine and for us to be able to provide it to that community. So we're very excited about our visitors being here today. So we're still going in a positive direction with our data. We're very pleased with that. As of this morning, we have 83,709 cases, and that's an increase of 220 in a 24-hour period. We have been averaging over the past week somewhere around 300 cases per day. It goes up and down a little bit, but continuing to go on a slow but steady decline at this point post-holiday surge, so we're very pleased again with that. Our reproductive rate has remained below 1, and that's positive as well. Unfortunately, with our current deaths, we're at 1,318 deaths, and that's increased slightly to 1.6 overall mortality rate. We had been fairly steady at 1.5% throughout the pandemic. Our hospitals are doing well. We do know this time of year that typically we would see flu, but we're not seeing much flu. And so we know that the hospitals are able to care for the individuals who are presenting.